Hello, my name is Judd Hannigan, and I'm with Redwood Medical. We're here today at Jingmen Hospital, speaking with Dr. Yang Chun Hua. Dr. Yang is the Deputy Director of Physicians and Treatment of Retinitis Pigmentosa. She's also the Deputy Director of the China Institute of Health Science Technology for the treatment of incurable diseases. A member of the Chinese Medical Association, Dr. Yang is a leader in the exploration and theory of retinitis pigmentosa. She's been practicing clinically for the last 3 decades, and we're very excited to have her with us today. Dr. Yang, thank you very much for taking time to speak with us about this exciting treatment. Dr. Yang, if you could, please begin by telling us a little bit about yourself and perhaps introducing your surgical team as well.
实质上这个手术呢，它的原始手术
This kind of treatment and also this surgery is not my personal invention. I graduated from the Nanjing Railway Medical College and later completed my doctorate at Chengde Medical College. At the time, there were 2 very famous domestic ophthalmologists, Dr. Tan and Dr. Zhou, and I was fortunate that both were my teachers there. Because I was just a scholar and our textbooks had no information or tutorials on RP disease, I did not participate in their treatment process. I always think that that is one reason why the treatment method of this disease is growing so slowly. One could say it's a tragedy. Medical students don't learn how to treat this disease, and textbooks don't mention it either. For example, I've got one book here called Practical Ophthalmology. The book refers to retinitis pigmentosa, and the conclusion is that at the current time, there is no effective treatment at home and abroad. Teachers did not teach the treatment, it was never published in a book, and the idea that there is no effective treatment became conclusive. But I was lucky, because at the time, the teachers at Chengde Medical College did not give up in their efforts to treat this disease. But there were many constraints such as equipment, funding, and other conditions. 2 of my teachers worked for 25 to 30 years. Ultimately, they failed to come up with valid evidence proving the treatment was effective. But many patients have undergone this treatment, and it has been proven effective indeed. This means that, although there is no conclusive objective data to prove this approach is correct, the patients concur that it is effective. Based on this, our teachers taught 6 students how to treat this disease, myself being one of them. I've been able to continue until today, in large part because of support from another expert I met in 1998, Dr. Tsai of Beijing University Medical College, whose work with this treatment method provided an effective theoretical basis. I started as a teacher's assistant, learning the surgery, and later became an independent doctor, performing the surgery on my own. I wouldn't have been able to do this today without the years of work put forth by my predecessors. At present, most of the patients we treat come to us via word of mouth. As for the final results of the operation, some post-operative patients will find that the disease ceases to develop and their vision stops getting worse, while others have seen improvement in their vision after the surgery. As for the surgical team, there are 5 people in total, including the attending physician, the first assistant, second assistant, anesthesiologists, and nurses.
So how long have you been performing this surgery?
82年到现在
Since 1982, but I began to research and treat RP disease full-time when I moved to Beijing after my studies in Chengde. As a student in Chengde, I had to treat many different kinds of eye disease. When I arrived in Beijing, I decided to focus on this one particular disease.
Before the first operation, how long did you research this surgery?
是这样，那个最初呢，我是以进修生的姿态。
Initially, I was an advanced student participating in the surgery, but basically just observing. My first time as a physician in charge to independently implement this surgery was in 1983. The patient was a locomotive driver from the southern city of Changsha.
So tell us, how many patients have you performed this surgery on?
First, I do not like to use the word cure for this disease. I repeatedly stress it's about control and improvement. For the patients who are nearly blind, we help them to delay blindness. As for the early stage patients, we help to control and improve their vision to prevent blindness. If you mean the total number of patients I have treated for this disease, it's more than 4,360.
If you wouldn't mind, Dr. Young, could you please explain to us a little bit more detail about the surgery?
我只能粗略的介绍一下，好吧？这个手术的本身呢，它是在眼球壁上方赤道部来操作的。
I would like to provide an overview. The surgery is over the eye wall of the side equator, and it's very safe. Dr. Tsai, who I mentioned earlier, wrote in a published article that there is a genetic variation for this disease, which is likely to cause variation in the choroidal vascular wall, causing it to atrophy. When this happens, the blood flow slows, causing nutritional deficiency. Retinitis pigmentosa patients typically have high blood pressure, high cholesterol, or diabetes. However, RP patients are somewhat lucky because high blood pressure and other common diseases often spread, affecting other areas of the body. In RP patients, this is not the case. Even in the last degree of blindness, where the choroidal and retinal vessels are damaged, the other vessels remain healthy. It's because of this that our treatment can be successful. If, like other diseases affecting blood vessels, if we transplanted any blood vessels to the eye, it would be useless. Although RP disease has been deemed an incurable disease in the international arena, we feel that patients still have a glimmer of hope. We operate in the patient side of the equator of the eye wall and use the patient's healthy blood vessels. We drain to the periosteum choroidal area, close to a ring of arteries known as Heller's circle. It's in this location that there are 5 branches of vessels which direct to the optic disc, the retinal periphery, the macula, and the sides of the optic nerve. It's similar to irrigating and fertilizing plants, as there are a lot of roots. We don't need to pour water into every root, but only on the surface of the soil, as the water will absorb on its own.
And how long does the surgical procedure take?
手术的全过程呢是1个小时。
The surgery is approximately an hour and 15 minutes, but if you count the anesthesia and the anesthetic recovery, then the whole process takes about 2 hours.
So what is the recovery time for these patients?
The hospital recovery time is about 15 days. Most patients see results within 3 to 6 months.
This is very interesting. So what is the success rate you've had with these patients?
96%。我都不敢提成功。
The rate we have seen is about 96%, but I will not say success rate so far. I would rather speak conservatively, as, after all, this kind of surgery is not widely recognized throughout the world as of yet.
Dr. Young, thank you so much for your time today. Is there anything else you would like potential patients from overseas to know before coming here to China for this procedure?
For overseas patients, if they would like to know more about our hospital or this kind of surgery, it's best communicated in English by professionals, medical companies, or other organizations that understand RP disease and the treatment process we are administering.
Thank you again, Dr. Young. It's been a real pleasure.
谢谢，不客气，不客气。